I got involved with the PPG because I'd done some previous work with cancer peer support, and I thought, the thing is, you talk a lot about us and them, but if you don't get off your backside and join in, then you can't complain about the services you are receiving. So I thought, I've moved to this area and I want to get involved, so I'll go along and see what I can do for the PPG.
When you move to a new area, you've got to find people. You can't expect people to find you.
We joined the local community things, and we didn't know anybody at the surgery, and so in order to put faces to names we had heard about, it seemed a good idea. We've met the people, and instead of them being disembodied voices down the phone, we now recognise them as friends and real people.
We have two PPG groups, one for the Royal Crescent surgery and one for Preston surgery. I send out monthly practice newsletters to the groups. I help to organise the meetings. We try to hold 3 to 4 a year, but sometimes we may have smaller meetings if there's specific queries or things, anything that we'd like the PPG to help with. I'm immensely proud of our Healthy Living event, which was born really the idea from the PPG groups. We all got together with the Preston PPG, so the two groups collaborated. They helped organise, create the group, the event. They helped with the advertising, getting the advertising out with flyers and posters, and on the day running the event.
And people could see what their cholesterol levels were like, what they weighed, what should be their best food, and things like that. And it went very well. It was nice to see everybody working together.
All the different care people, they were talking to each other. The public that came in weren't so nervous, they were asking questions, and it just seemed a really good idea. For the doctors to be there, the nurses to be there, the patients to be there, all working together can only improve what is on offer.
It's quite rewarding when you see 50 or 60 plus people actually attending something that you've helped to organise.
It's definitely important for GP practices to have a PPG group. They help us in so many ways, help us look about the different services we offer, how we can make them better for patients. A patient's point of view, things like they've helped us recently. We repainted the car park lines because we didn't realise, but patients couldn't see the differences to park. Any feedback from the group helps us as a practice, because we always want to learn how we can do things better, or if there's anything we're not doing quite right, we'd like to know about it. And obviously the PPG helps patients because it's their point of view that not every patient knows how to speak up. So through the PPG, they can tell us a patient's perspective.
A GP practice without an active PPG will not know what's going on in its community, and it can't improve its services. It needs to know what people think about what they're offering.
I think it breaks barriers down, it raises awareness of what GPs can do for you, it gives you further connections where you can go for further information.
I think patients are now better informed about our services and about the things that we offer. And for them, volunteering is a great way for them to meet new people, to interact with the staff, the doctors, and to make their patient experience much better.
And if you go into the doctor's surgery with a query and you meet somebody you know at reception, you feel you get better feedback.
Yes, and you feel a little bit more relaxed, don't you?
Yeah.
Rather than being, going to the surgery. It's a bit on edge, so it just helps to smooth things out a little.
Most of the time we moan, but it's nice to be able to feedback when things are going well.
I would encourage anybody, whether they've been living here for 60 years or 6, come and join us. We don't bite.